The NHS means so much. It's part of what makes Britain great.
It's that sort of fallback, isn't it? If you're ever ill, it's something there that's deemed to be looking after you all the time.
Well, I think it's a very important service that provides a lot for the community. People talk about problem, but the equipment, the facilities are amazing. Things that a lot of countries don't have it, and we tend to take it for granted. I like it. I appreciate it. It's excellent.
I'm from Africa, and looking at the healthcare system here and comparing it to that of Africa, it's a little bit stable. It's stable because they're always there when you need them, and they are ready to give you what you need when you want it, and the drugs are not substandard, and they are very good quality.
Gives everybody a peace of mind, doesn't it? In as much that you know it's there. You're always going to get the best treatment possible. That sort of thing.
Well, surely it needs improvements, but in general, it's a good service.
As it's good and bad.
So it makes a difference in terms of being able to access healthcare when perhaps you wouldn't be able to afford it otherwise. And of course, places like America, you can't even get the help you need unless you're financially able to do so. So here, there's no discrimination based on the fact that you haven't got money, so that's really good.
When my grandmother was young, she had a son who had a bad heart, and he went to hospitals galore, but they had to pay their doctors to come and everything. It was a lot of money for everyday people. It's all right if you had plenty of money.
People died younger, I think, because they couldn't afford medical help.
So it's really vital.
They're reliable, they are consistent, and they're cheerful.
Well, magnificent, really. Dependable and reassuring.
Helpful, charitable, great.
Absolutely first class.
Wonderful, wonderful, wonderful.
At the moment, the government seems to be cutting the NHS to a state where it's not actually working anymore, I don't think.
They need to be well equipped. Even if it means bringing in sophisticated machines and so on, just to make sure that people are alive, they just have to do it because people pay taxes, people pay for the services, and on the other hand, they deserve, the treatment. Yeah.
I think there's too much paperwork and people doing paperwork.
Too many backup staff as opposed to frontline people, i.e. nurses and doctors.
And needs better staff, more qualified staff.
Well, I think the challenge it's sort of global. The financial situation of the world is a huge challenge, and on top of that, as Matt said, I've got people from all over the world that work for the trust, and some of them are not, I would say, not well trained, and a lot of them don't really care, to be honest with you. They are there for the money, and that's a negative part of it.
Well, no government's loath to cut any money from it, but they're always going to be battling costs with rising people that want, we're living longer as a nation, so there's always going to be more demands put on it, but there's always going to be the cost restrictions.
Do you think this?
I don't think so. No, I think it's fine the way it is.
My life, so.
Yeah.
Well, it's a developing world, isn't it? It's forever an ever-changing world. So yeah, there'll always be certain needs that are not here now that will be in the future. Yes, so it will develop. It will just be a natural progression.
I think we must fight tooth and nail to kind of preserve the NHS.
Less politics, more action.